Hello, everyone. This is Dr. Sin, your OBGYN. Thank you so much for joining Unveiling the Private Face. So, we're going to wait for others to join in. And as you join, please like and share. We have some good stuff to talk about tonight. So, we want to give time for everyone to get in there. I see Maura joining. How are you, Miss Tia? Hello, Pam. Thanks, guys, for joining. As you join, please like and share with anyone that you think may need this message tonight. I think it's going to be quite interesting what we have to talk about. So please have people to join. I know many say, why talk about the private face, or what some like to call the vulva? Well, it's because many of us are uncomfortable with this area. There was no one in our family who was ever comfortable talking to us about the proper things to do when it comes to the private face. So we were left to our own devices. And in my 20 years of practicing OBGYN, I've come across many women who are more than just uncomfortable with this situation. They are ashamed and they are embarrassed. So that's why I'm here, to take the shame away. I want women to understand that the private face is just as beautiful as the public face. So once again, as you come in, please like and please share. We have a very interesting topic for tonight. Now, if you guys have questions as we go along, do not hesitate to put your questions in the comments, and I will try my best to get to all of them. If I miss some of your questions, I will get to them later and I'll be sure to respond. So don't be too upset with me if I miss it on tonight. So as you come in, please like and please share. All right, guys, let's go ahead and get to this. Our topic for tonight is reasons to be seen before you vaginal steam. All right, reasons to be seen before you vaginal steam. Some may say, well, what in the world is vaginal steaming? Others are like, oh, where can I go to get that? Because I've seen Gwyneth Paltrow and different people out there performing this. Well, my job is to make sure that you understand what vaginal steaming is all about, and to make sure that you understand when you need to seek additional assistance with the care down there. Okay? So vaginal steaming goes back hundreds and hundreds of years. It's a form of Eastern medicine from various continents, from South America to the Asian continents and to Africa. And in different areas, it's done different ways. But the gist of vaginal steaming is that warm water is used to create steam. And in that steam, there are a lot of natural herbs. Various herbs depending on what your problem is. And the thought is that the steam and the herbs will promote healing. Some of the things that it's been taunted as a benefit would be to help control bleeding, to relieve pain with menses, to help menopausal symptoms, things of that nature. Now, just so you guys know, there has been no scientific evidence that this works. Now, I tell my patients, if they ask about vaginal steaming, go ahead and try it, as long as they don't have any contraindications. So when I talk about contraindications to vaginal steaming, I'm talking about A, if you're pregnant, Don't go steam if you're pregnant, okay? B, if you have an IUD, I don't want you doing that with an IUD. C, if you have genital piercings, you need to remove the piercing before you steam because that heat can cause that metal to get hot and you can burn that very sensitive area. So if you have any type of piercing, make sure that you remove that before you steam. Okay. Also, I guess this would be D, if you are using any vaginal hormone creams or the vaginal ring, if you're postmenopausal, you should not be steaming if you're using any of those products. Okay, so other than these contraindications, let's talk about definitive benefits. All right, we talked about things that are touted as benefits of vaginal steaming, and we really don't know if they work or not. Many say that they do. There's no scientific evidence to support it, but if you feel that you're getting benefit from it, then why not try? Okay, we do know that steam can increase the blood flow, and with increase in blood flow that can promote health of the skin, at least at the area of the vulva. Now, is that steam going to penetrate deep into the vagina and the cervix and the uterus and the ovaries? From a physiologic perspective, probably not. Okay. However, we commonly use water bottles to put on our bellies when we have painful periods. So it's possible that steam may help with pain with our menses if the water bottle helps with pain with menses. So it's worth trying as long as you don't have any of the contraindications. Now, I don't recommend trying to steam at home. And the reason why I don't recommend trying to steam at home is because you really need to control the temperature. So you really want someone who's used to doing this and knowing what they're doing to help you out when it comes to vaginal steaming. The last thing you want to do is scald your private face. Okay, that would not be a good day for anyone if you did that. So the big thing that we're going to do today is talk about 7 medical conditions that you need to have evaluated prior to participating in vaginal steaming. Okay, so number 1, if you are having pain with urination, or if you're having marked pain with sex, you need to be evaluated before steaming. Okay, you may have a simple urinary tract infection that steam is not going to cure. You may have something going on deep in the vagina that needs to be looked at, so we know if it's something that needs to be removed or treated in other ways. So if you're having pain with urination or very, very painful intercourse, please make sure that you're seen by your gynecologist prior to participating in vaginal steaming. Is everyone okay with that? All right, number 2, unexplained vaginal bleeding. Once again, steaming is touted as a benefit, one of the benefits being treatment of irregular bleeding. Scientifically, that has not been proven. Once again, if my patients want to try that, I don't have a problem with that, as long as their unexplained bleeding has been evaluated. So let me give you guys an example. If you are postmenopausal, that means you have gone an entire year without having a period. And then out of the blue, you start bleeding. I don't recommend for you to go steam in this situation. You need to be evaluated. Postmenopausal bleeding is imperative that we rule out endometrial cancer before anything else is done. So that's an example of the importance of being properly evaluated before participating in vaginal steaming. Also, let's say that you have a very long history of missing periods, that you're not postmenopausal, but even in your 20s, You may go months before you have a period. They'll be regular for a while. You go longer periods of time without having periods. And let's say maybe you're a little bit overweight. Before you steam, you need to be evaluated because women with polycystic ovarian syndrome, and commonly they will have periods that are further and further apart than normal. Those women can be at increased risk, once again, for endometrial cancer or cancer of the uterus. So it's important if you have unexplained vaginal bleeding that you get it checked out first. Now, if you get those things checked out and you get that great bill of health, then go ahead, try the steaming. Number 3, blisters, sores, or warts. If any of those things are happening, do not steam. We need to have that evaluated first, okay? If you have a history of herpes, it's okay to steam. Just do not steam when you are having an active outbreak. If you have any type of open wound, do not steam. That needs to be evaluated, that needs to be treated, because steaming can increase infection. Now, it's said that one of the benefits of steaming is to treat infection or decrease infection because of the heat. One of the things that we do know is that within our vagina, we have good bugs that are there. We have normal bacteria that are our personal warriors, and they help keep bad bacteria away. So if you are steaming the good warriors away, you could be more prone to bring bad bacteria in. All right, so just something to think about. No open wounds should you steam. And if you find out with steaming you're starting to get more infections, please make sure that you come in to be evaluated. So does anyone have any questions right now? Any questions? If you have any questions, please place them in the comment box. All right, we're going to keep going. So, if you have a marked change in your vaginal smell, make sure you are evaluated before you steam. All right. The vagina does not naturally smell like roses. We all know that. And that's okay. But you know what your smell is like. So if you all of a sudden know a change in your personal smell, make sure that you're getting examined prior to steaming. Now, if you want to steam, it's okay. But if you have a marked change in your smell, make sure that that is evaluated. Abnormal vaginal discharge. If you have green discharge, yellow or gray discharge, anything of that nature, it needs to be evaluated prior to steaming. We need to make sure, A, you don't have an STD, B, you don't have bacterial vaginosis, something of that nature that needs to be treated with medication. All right? So please make sure that you take time out to be seen by your gynecologist or your primary care doctor and have that looked at so that you can be treated quickly, and then you can get to steaming if that's what you choose to do. All right. Persistent vaginal itching. If the itch is not going away, once again, it needs to be evaluated. Sometimes itching can be a sign of infection. Sometimes itching can be related to marked decrease in our hormone levels as we get older, and the skin down there becomes very thinned and easily abraded. So it's important that you get that evaluated before you choose to steam. And lastly, a rapidly growing belly. Now, we have heard with steaming that a lot of women with uterine fibroids they say that they have some relief. And that may be true. I don't know. Once again, there's no scientific studies to prove that that is the case. However, if you suffer from fibroids and you would like to try out steaming, go ahead, knock yourself out. However, If you notice that your belly is growing markedly in a short period of time, if over a few months you all of a sudden look like you're 9 months pregnant, that needs to be evaluated. Rapidly growing fibroids are at increased risk for uterine sarcomas, and that's a cancer of the uterus. So those are the type of things that we can't shy away from, that we have to make sure that we are evaluating. So once again, it's okay to steam. Just make sure that you are aware of the contraindications. So don't steam if you're pregnant. Do not steam if you have an IUD. If you have genital piercings, make sure that you remove them. And no steaming if you're using hormonal creams or hormonal rings. And then secondly, please make sure that you're paying attention to anything that is abnormal that needs to be addressed prior to steaming. So pain with urination or pain with sex, unexplained vaginal bleeding, blisters, sores, or warts, marked changes in the vaginal smell, abnormal vaginal discharge, persistent vaginal itching, or rapidly growing belly. If any of those things are going on, I encourage you to get that checked out ahead of time. So some said, well, what about keloids? Is it okay to steam if you have keloids? It's okay to steam if you have keloids. Once again, don't steam at home. Go somewhere where they are used to doing the steaming. They have set protocols, and you're making sure that that temperature is not too hot for you, because if you do scald that area and you're prone to keloids, that you may have more keloid formation. Now, can steaming help with the treatment of keloids? That hasn't been scientifically proven, but from a physiologic perspective, there may be some improvement. What steaming will do is increase that blood flow, all right? And if you increase the blood flow to the skin, that is going to promote healing, all right? So it's worth trying if you see that. Any other questions? Any questions right now? Let me scroll down here so I can see. Why, thank you. Well, my Aunt Lucy joined. Thank you. Okay. I believe that is all of our questions for tonight. And once again, I am Dr. Sin, your OBGYN national speaker and vulvar skin specialist. By my educational sessions and my soon custom product line, I help women to optimize the skincare of the private face so that they realize that this area can be just as beautiful as their public face. Okay, so if you want to learn how to make your private face vulvaceous, tune in every Thursday at 7 p.m. and we're going to have wonderful topics to discuss. So, one other question here. Can you get keloids on your poom poom? Yes, ma'am. You can get keloids wherever you have skin. So think about that. Think about that when you're shaving. Think about that when you try to steam at home without assistance. That's a precious area. It's a very sensitive area, so you have to take special care of it. So you guys keep that in mind. Any other questions right now? So you guys make sure you follow me on all social media platforms at Dr. Sin OBGYN. Okay, so I'm on Facebook, Instagram, Twitter at Dr. Sin OBGYN. All right, guys, you have a wonderful evening. And if there's any questions that I missed, I will get back to them and I'll do my best to answer. And I'll see you guys next Thursday at 7 p.m. Have a good evening.